Hello, my name is Mike Ackerman, and I'm a genetic cardiologist at the Mayo Clinic in Rochester, Minnesota. I also have the privilege of serving as the president of the Sudden Arrhythmia Death Syndromes Foundation, the SADS Foundation. On behalf of Alice Laura, CEO of the SADS Foundation, and all of our staff at SADS, we invite you to get to know us at www.stopsads.org. Alice and her team are here to help individuals and families affected by a potentially dangerous genetic heart rhythm condition, a SADS condition, to not only live, but to thrive despite that condition. We at the SADS Foundation are excited about our successful relaunch of the Heart of the Matter Question of the Month series, where you ask and we will answer your questions. This past month, many great questions have been received. Thanks for sending them our way. This month's question is, should we get an automatic external defibrillator, an AED, for our family? Thank you for asking this great question. The short answer is yes, get an AED. In fact, don't just obtain an automatic external defibrillator, an AED, learn CPR and learn how to use that AED. However, don't expect to have to use that AED anytime soon. In other words, the AED is simply part of our overarching Boy Scout or Girl Scout Be Prepared strategy. It is part of family safety gear. Just like the fire extinguisher is part of our family safety gear, we know where it is and we know how to use it. In fact, remember, pass, point, aim, squeeze, sweep, that's bonus. But anyway, we have never had to use our fire extinguisher. The AED can and should be viewed just like this. Having an AED for a family with a genetic heart rhythm condition is like having an EpiPen for the family where there is someone with a life-threatening peanut allergy, for example. Now, even though we at the SADS Foundation encourage families to get an AED, it is critical to remember that if the person with the genetic heart rhythm condition, like long QT syndrome, for example, as one of the SADS conditions, is well treated, that AED should almost never be necessary. In fact, among the past 600 plus adults with long QT syndrome who I have cared for, there has never been the need of an AED rescue shock. And among the 500 plus children with long QT syndrome under our care, only 4 children out of over 500, only 4 children out of over 500 have ever received an AED rescue shock over the first 20 years of my medical career. If they are well treated, that AED should almost never be needed. Now, because our families will almost never need to use their AED, sometimes they're hard to get paid for. Sometimes insurance companies refuse to pay for this piece of so-called durable medical equipment. These AEDs, in fact, can be obtained without a prescription. And if not covered, an AED can cost anywhere from around $1,000 to $2,500. However, if you need help in trying to obtain an AED for your family, contact us at the SADS Foundation at www.stopsads.org. Our team will do their best to help. In addition, your physician can team up with our friends at LifeSure at www.lifesureaed.com, where they at LifeSure have a staff devoted to helping families get a home AED and to get your health insurance company to cover it. So remember, even though an AED makes great sense as part of family safety gear, when these conditions are well treated, that AED should almost never be needed for anyone in your family. Instead, your AED will more likely be needed for the referee who is officiating your child's soccer game, or for the older spectators in the stands who are watching. For more information on SADS conditions and the SADS Foundation, please check us out at www.stopsads.org. In closing, on behalf of Mayo Clinic's Genetic Heart Rhythm Clinic, the Winland Smith Rice Comprehensive Sudden Cardiac Death Program at Mayo Clinic, and on behalf of Alice Laura, the CEO of the SADS Foundation, thanks for joining me today. And remember, the SADS Foundation is here for you and your family. Please join us in our life-saving and life-giving mission.